Pancreatic cancer. Definition. Pancreatic cancer is a type of cancer that starts in the pancreas. Cancer starts when cells in the body begin to grow out of control. Pancreatic cancer is aggressive with few symptoms until the cancer is advanced. Symptoms may include abdominal pain, weight loss, diarrhea, and jaundice. Pancreatic cancer arises when cells in the pancreas begin to multiply out of control and form a mass. These cancerous cells have the ability to invade other parts of the body. Risk factors. While the cause of this type of cancer is unknown, there are certain risk factors that may increase chances of developing pancreatic cancer, such as smoking cigarettes. 30% of cancer cases are related to cigarette smoking. Obesity. Not exercising regularly. Eating diets high in fat content. Drinking heavy amounts of alcohol. Having diabetes. Working with pesticides and chemicals. Having chronic inflammation of the pancreas. Having liver damage. Being African American. Having a family history of pancreatic cancer or certain genetic disorders that have been linked to this type of cancer. Causes. The cause of pancreatic cancer is unknown. This type of cancer occurs when abnormal cells begin to grow within the pancreas and form tumors. Normally, healthy cells grow and die in moderate numbers. In the case of cancer, there is an increased amount of abnormal cell production, and these cells eventually take over the healthy cells. The two most significant risk factors are inherited gene mutations and acquired gene mutations. Genes control the way cells act, so changes to those genes may lead to cancer. Pancreatic cancer types. Based on location of pancreatic cancer. In the head of the pancreas, if the malignant tumor lies in the head of the pancreas, which happens in 60% of the cases. This type of tumor is manifested as weight loss, abdominal pain, and jaundice. In the tail and body of the pancreas, a small percentage of the cases include invasion of the tail and body of the pancreas, which is manifested as sudden weight loss and abdominal pain. Based on function of the pancreatic cells, exocrine tumors and endocrine tumors. Exocrine tumors. The exocrine glands are those that secrete the enzymes and release on the epithelial surface of the duct. For example, sweat glands, salivary glands, mammary glands, lacrimal glands, etc. The tumors existing in these cells are known as exocrine tumors. The most common types of exocrine tumors are listed below. Ductal adenocarcinoma, acinar cell carcinoma, adenosquamous carcinoma, intraductal papillary mucinous neoplasm, mucinous cystadenocarcinoma, pancreatoblastoma, serous cystadenocarcinoma, pseudopapillary tumors. Endocrine tumors. The endocrine glands are those which secrete the enzymes or hormones directly into the blood rather than releasing it through a ductal system. The most common examples of endocrine glands are pineal gland, pituitary gland, etc. The most common endocrine tumors are listed below. Glucagnomas, alpha cells. Insulinomas, beta cells. Pepomas. Somatostatinomas. Vipomas. Clinical manifestations. In general, the signs and symptoms of pancreatic cancer can be produced by exocrine or endocrine cancer cells. Many of the signs and symptoms of exocrine pancreatic cancer result from blockage of the duct that travels through the pancreas from the liver carrying bile to the intestine. Signs and symptoms of exocrine pancreatic cancer include jaundice, dark urine, itchy skin, light-colored stools, pain in the abdomen or the back, poor appetite and weight loss, digestive problems, pale and or greasy stools, nausea and vomiting, blood clots, and enlarged gallbladder. The signs and symptoms of endocrine pancreatic cancers. Insulinomas. Insulin-producing tumors that lower blood glucose, sugar, levels can cause low blood sugars that result in weakness, confusion, coma, and even death. Glucagnomas. Glucagon-producing tumors can increase glucose levels and cause symptoms of diabetes, thirst, increased urination, diarrhea and skin changes, especially a characteristic rash termed necrolytic migratory erythema. Gastrinomas. Gastrin-producing tumors trigger the stomach to produce too much acid, which leads to ulcers, black tarry stools, and anemia. Somatostatinomas. Somatostatin-producing tumors result in other hormones being overregulated and producing symptoms of diabetes, diarrhea, belly pain, jaundice, and possibly other problems. Vipomas. These tumors produce a substance called vasoactive intestinal peptide, VIP, that may cause severe watery diarrhea and digestive problems along with high blood glucose levels. Pepomas. These tumors produce pancreatic polypeptide, PP, that affects both endocrine and exocrine functions, resulting in abdominal pain, enlarged livers, and watery diarrhea. Carcinoid tumors. These tumors make serotonin or its precursor, 5-HTP, and may cause the carcinoid syndrome with symptoms of flushing of the skin, diarrhea, wheezing, and a rapid heart rate that occurs episodically. Eventually, a heart murmur, shortness of breath, and weakness develop due to damage to the heart valves. Pancreatic cancer stages. Staging helps explain how advanced the cancer is. It also helps doctors determine treatment options. Once a diagnosis has been made, the doctor will assign a stage based on the test results. Stage 1. Tumors exist in the pancreas only. Stage 2. Tumors have spread to nearby abdominal tissues or lymph nodes. Stage 3. The cancer has spread to major blood vessels and lymph nodes. Stage 4. Tumors have spread to other organs, such as the liver. Diagnostic evaluation. Several types of diagnostic tests and investigations are required to reach a final diagnosis. History taking. Take a thorough medical, surgical, dietary, family, occupational exposure, environmental, personal habit history. Physical exam. This is the first and the foremost examination which is conducted clinically. The doctor will look for the signs of jaundice by looking at the skin and eyes. The abdomen is also examined to look for any changes near the pancreas, liver, or gallbladder and also to check ascites. Lab investigations. After the doctor finds out any positive signs during the clinical examination, he sends the patient for further lab investigations where blood, urine, and stool samples are taken to check the bilirubin levels and certain other substances. Very high bilirubin levels may be indicative of cancer or certain other non-cancerous conditions. CT scan. Computed tomography scan is done to take images of the pancreas and other nearby organs and blood vessels in the abdomen. Ultrasonography. It may be a transabdominal ultrasound, done externally, and endoscopic ultrasound, done internally. Endoscopic retrograde cholangiopancreatography, ERCP. An instrument called an endoscope is passed through the patient's mouth to the first part of the small intestine. In this way, the X-ray pictures of the bile ducts and the pancreatic ducts to check if they are blocked or narrowed by a tumor or any other condition. PTC, percutaneous transhepatic cholangiography. A dye is injected through a needle inserted through the skin into the liver. If there is no blockage, the dye moves freely through the ducts, whereas if the dye is accumulated at one place, it may indicate a blockage from a tumor or any other condition. Biopsy. In some of the complicated cases, the doctor may also need to remove a part of the affected tissue. This tissue sample is sent for the lab investigations to look for cancer cells under a microscope. The tissue sample is either obtained by fine needle aspiration, during ERCP, or during an operation from an open abdomen. Management. When detected at an early stage, pancreatic cancer has a much higher chance of being successfully treated. However, there are also treatments that can help control the disease for patients with later stage pancreatic cancer to help them live longer. Surgery. Surgery for pancreatic cancer includes removing all or part of the pancreas, depending on the location and size of the tumor in the pancreas. An area of healthy tissue around the tumor is also often removed. This is called a margin. A goal of surgery is to have clear margins, or negative margins, which means that there are no cancer cells in the edges of the healthy tissue removed. Different types of surgery are performed depending on the purpose of the surgery. Laparoscopy. Sometimes, the surgeon may choose to start with a laparoscopy. During a laparoscopy, several small holes are made in the abdomen and a tiny camera is passed into the body while a patient receives anesthesia. Anesthesia is medication to help block the awareness of pain. During this surgery, the surgeon can find out if the cancer has spread to other parts of the abdomen. If it has, surgery to remove the primary tumor is generally not recommended. Surgery to remove the tumor. Different types of surgery are used depending on where the tumor is located in the pancreas. In all of the surgeries discussed below, nearby lymph nodes are removed as part of the operation. More than one type of surgeon, as well as other specialists, will usually be involved in surgery. Whipple procedure. This surgery may be done if the cancer is located only in the head of the pancreas. This is an extensive surgery in which the surgeon removes the head of the pancreas and the part of the small intestine called the duodenum, as well as the bile duct and stomach. Then, the surgeon reconnects the digestive tract and biliary system. Distal pancreatectomy. This surgery is commonly done if the cancer is located in the tail of the pancreas. In this surgery, the surgeon removes the tail and body of the pancreas, as well as the spleen. Total pancreatectomy. If the cancer has spread throughout the pancreas or is located in many areas in the pancreas, a total pancreatectomy may be needed. A total pancreatectomy is the removal of the entire pancreas, part of the small intestine, a portion of the stomach, the common bile duct, the gallbladder, and the spleen. Radiation therapy. Radiation therapy is the use of high-energy X-rays or other particles to destroy cancer cells. A doctor who specializes in giving radiation therapy to treat cancer is called a radiation oncologist. The most common type of radiation treatment is called external beam radiation therapy, which is radiation given from a machine outside the body. Learn more about the basics of radiation therapy. External beam radiation therapy is the type of radiation therapy used most often for pancreatic cancer. A radiation therapy regimen, or schedule, usually consists of a specific number of treatments given over a set period of time. There are different ways that radiation therapy can be given. Traditional radiation therapy. This is also called conventional or standard fraction radiation therapy. It is made up of daily treatments of lower doses of radiation per fraction or day. It is given over 5 to 6 weeks in total. Stereotactic body radiation, SBRT, or cyberknife. These are shorter treatments of higher doses of radiation therapy given over as few as 5 days. This is a newer type of radiation therapy that can provide more localized treatment in fewer treatment sessions. Whether this approach works as well as traditional radiation therapy is not yet known, and it may not be appropriate for every person. It should only be given in specialized centers with experience and expertise in using this technology for pancreatic cancer and identifying who it will work best for. Proton beam therapy. This is a type of external beam radiation therapy that uses protons rather than X-rays. At high energy, protons can destroy cancer cells. It also lessens the amount of healthy tissue that receives radiation. Proton beam therapy may be given for a standard amount of time or for a shorter time like SBRT. It is not yet known whether it works better than standard radiation therapy, and it may not be an option for every person. It should be given in treatment centers that have the experience and skills needed to use this treatment for pancreatic cancer, which may only be available through a clinical trial. Often, chemotherapy, see below, will be given at the same time as radiation therapy because it can enhance the effects of the radiation therapy, which is called radiosensitization. Combining chemotherapy and radiation therapy may occasionally help shrink the tumor enough so it can be removed by surgery. However, chemotherapy given at the same time as radiation therapy often has to be given at lower doses than when given alone. Radiation therapy may be helpful for reducing the risk of the pancreatic cancer returning or regrowing in the original location. But there remains much uncertainty as to how much, if at all, It lengthens a person's life. Therapies using medication. Systemic therapy is the use of medication to destroy cancer cells. This type of medication is given through the bloodstream to reach cancer cells throughout the body. Systemic therapies are generally prescribed by a medical oncologist, a doctor who specializes in treating cancer with medication. Common ways to give systemic therapies include an intravenous, 4, tube placed into a vein using a needle or in a pill or capsule that is swallowed orally. Chemotherapy is the main type of systemic therapy used for pancreatic cancer. However, targeted therapy and immunotherapy are occasionally used and are being studied as potential treatments. Chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells, usually by keeping the cancer cells from growing, dividing, and making more cells. A chemotherapy regimen, or schedule, usually consists of a specific number of cycles given over a set period of time. There is usually a rest period in between cycles. A patient may receive one drug at a time or a combination of different drugs given at the same time. The following drugs are approved by the U.S. Food and Drug Administration, FDA, for pancreatic cancer. Capecitabine, Xeloda. Erlotinib, Tarkeva, a type of targeted therapy, see below. Fluorouracil, 5-FU. Gemcitabine, Gemzar. Irinotecan, Camptosa. Leucovorin, Velcovorin. Nab-paclitaxel, Abraxane. Nanoliposomal irinotecan, Onivide. Oxaliplatin, Eloxatin. Targeted therapy. Targeted therapy is a treatment that targets the cancer's specific genes, proteins, or the tissue environment that contributes to cancer growth and survival. This type of treatment blocks the growth and spread of cancer cells and limits damage to healthy cells. Erlotinib, Tarkeva, is approved by the FDA for people with advanced pancreatic cancer in combination with the chemotherapy drug gemcitabine. Erlotinib blocks the effect of the epidermal growth factor receptor, EGFR, a protein that can become abnormal and help cancer grow and spread. The side effects include a skin rash similar to acne, diarrhea, and fatigue. Olparib, Lynparza, is approved for people with metastatic pancreatic cancer associated with a germline, hereditary, BRCA mutation. It is intended for use as maintenance therapy after a patient has been on platinum-based chemotherapy, such as oxaliplatin or cisplatin, for at least 16 weeks with no evidence of disease progression. Larotrectinib, Vitrakwi, is a tumor-agnostic treatment that can be used for any type of cancer that harbors a specific genetic change called an NTRK fusion. This type of genetic change is found in a range of cancers, including pancreatic cancer, though it is rare. It is approved as a treatment for pancreatic cancer that is metastatic or locally advanced and has not responded to chemotherapy. Immunotherapy. Immunotherapy, also called biologic therapy, is designed to boost the body's natural defenses to fight the cancer. It uses materials made either by the body or in a laboratory to improve, target, or restore immune system function. Immune checkpoint inhibitors, which include anti-PD-1 antibodies such as pembrolizumab, Keytruda, are an option for treating pancreatic cancers that have high microsatellite instability, MSIH. Approximately 1% to 1.5% of pancreatic cancers are associated with high MSIH. Supportive care for people with pancreatic cancer may include palliative chemotherapy. Any chemotherapy regimen discussed above may help relieve the symptoms of pancreatic cancer, such as lessening pain, improving a patient's energy and appetite, and stopping or slowing weight loss. This approach is used when the cancer has spread and cannot be cured, but the symptoms of the cancer can be improved with chemotherapy. When making decisions about palliative chemotherapy, it is important that you and your doctor weigh the benefits with the possible side effects and consider how each treatment might affect your quality of life. Relieving bile duct or small intestine blockage. If the tumor is blocking the common bile duct or small intestine, placing a tiny tube called a stent can help keep the blocked area open. This procedure can be performed using non-surgical approaches, such as ERCP, PTC, or endoscopy. A stent can be either plastic or metal. The type used depends on the availability, insurance coverage cost, a person's expected lifespan, and whether the cancer will eventually be removed with surgery. In general, plastic stents are less expensive and are easier to insert and remove. However, they need to be replaced every few months, are associated with more infections, and are more likely to move out of place. Stents are typically placed inside the body, but sometimes, a tube may need to be placed through a hole in the skin of the abdomen to drain fluid, such as bile. This is called percutaneous drainage. Sometimes, a patient may need surgery to create a bypass, even if the tumor itself cannot be completely removed. Improving digestion and appetite. A special diet, medications, and specially prescribed enzymes may help a person digest food better if their pancreas is not working well or has been partially or entirely removed. Meeting with a dietitian nutritionist is recommended for most patients, especially for those who are losing weight and have a poor appetite because of the disease. Controlling diabetes. Insulin will usually be recommended if a person develops diabetes due to the loss of insulin produced by the pancreas, which is more common after a total pancreatectomy. Relieving pain and other side effects. Morphine-like drugs called opioid analgesics are often needed to help reduce pain. Special types of nerve blocks done by pain specialists may also be used. One type of nerve block is a celiac plexus block, which helps relieve abdominal or back pain. During a nerve block, the nerves are injected with either an anesthetic to stop pain for a short time or a medication that destroys the nerves and can relieve pain for a longer time. A nerve block can be performed either percutaneously, through the skin, or with an endoscopic ultrasound, see above. Depending on where the tumor is located, radiation therapy can sometimes be used to relieve pain. Prevention. Some lifestyle changes and overall health approaches may reduce risk. These include: quit smoking. Smoking increases risk for several types of cancer, including pancreatic cancer. Drink less. Heavy drinking may increase risk for chronic pancreatitis and possibly pancreatic cancer. Maintain a healthy weight. Being overweight or obese is a leading risk factor for several types of cancer.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.